Welcome to Prescription for Primary Care, presented by Healthion. I'm Natasha Tranos, a marketing specialist with Healthion, and your host for today's episode. Today, we're going to be discussing a critical issue in Canadian healthcare with Dr. Brian Rottenberg, and our topic is the debate between public and private healthcare in Canada. So, welcome to today's discussion, Dr. Rottenberg.
Thank you for having me.
So, you recently shared your thoughts on a LinkedIn post about a draft policy from the Canadian Medical Association. Can you tell us a bit more about this?
Certainly. So I come at this from the perspective of a surgeon. I'm not a primary care provider. I'm an otolaryngology head and neck surgeon. So within that space, there has been a lot of discussion in Canada recently about the role for non-hospital based but publicly funded care. So in other words, you need a surgery of some sort. For example, in my life, let's say a tonsillectomy. And for the most part, these take place almost exclusively in a hospital because that's where the resources are. However, the wait times for care across Canada for surgeries that are important and medically necessary but not urgent are overwhelming. We're amongst the worst in the entire OECD grouping. And so there's been an increased discussion nowadays about taking some of this work outside of the hospital and putting it into non-hospital based but accredited surgical facilities, or what they call in the vernacular surgery centers. These are in common use all around the world, not just in the United States, but in Europe and Australia, everywhere really but Canada. Canada's very much late to the game for that. In saying that, there are also very valid concerns raised by many people about what are the implications for this for publicly funded care. For example, you're taking nurses or physicians out of the hospital, that means they can't do work in the hospital anymore. What does that mean? Who's going to cover the costs? What are the human health resource implications? And so there has been a recent CMA suggestion that the CMA would not support this kind of work because of the detrimental effects on publicly funded care. And that's the piece that I'm referring to, where there is a physician colleague of mine who put together a petition saying that they did not support the CMA's stance on this and that we need to think more broadly about solving healthcare issues. And that's the genesis of this discussion today.
Okay, yeah, thank you for sharing. So you mentioned in your post that the CMA's mission is to kind of support doctors and ensure Canadians can access care. So how do you feel their current stance aligns kind of with the mission?
Well, I think that the problem is that the key word there is access. We in Canada have a publicly funded system, one of the main tenets of which is the concept of universal access to care that should not be barrier, for example, due to financial reasons. And as we kind of tongue-in-cheek joke about, Canadians all have universal access to the waitlist, but they're not actually getting care. And that's the problem, in that there is not universal access to care anymore. Canadians simply can't access care. If you have an acute medical issue, for example, a heart attack or something that needs an urgent surgery like an appendectomy, your care is going to be great here in Canada. But for the many, many chronic issues that our Canadians are facing, they are having such difficulties accessing care relative to other countries in the world that I don't think we can plausibly say we have a functional healthcare system anymore when it comes to surgery.
Yes, absolutely. I know that's a big concern, especially during COVID. Many people had such long wait times, they didn't even get to have their surgeries, and it just led to so many more issues for them.
That's right.
What actions do you think are being taken in response to this draft policy?
Well, so I can only speak really to Ontario as that's where I work, and my knowledge is limited for other provinces. In Ontario, the Ontario Medical Association has drafted a proposal for changes to how care can be delivered here in the province, one of which is the concept of an ICHSC, Integrated Community Health Surgical Center, which is like basically a surgical center. And what they proposed here is that ICHSCs should be developed. They should be publicly funded so that they can deliver publicly insured care that nobody's paying for. It's just care outside the hospital. That is a wonderful suggestion. It's one that I think is long overdue for Ontario. There are other provinces that have similar concepts to ICHSCs, Saskatchewan, Alberta, BC, Quebec. So Ontario is late to the game with that, but our need here is more pressing than any other province because of our large population and our inability to serve their needs. So I think the OMA is exactly on the right track with this, and I hope that it follows through.
Yes, absolutely. So the CMA's data also shows that a majority of physicians and Canadians support patients' rights to pay for health services when the public system cannot provide timely access. How might this impact the discussion kind of around healthcare reform?
Well, that's a very nuanced question. So I'm going to start off with my reply being that as currently discussed, what we're looking for is publicly funded care outside the hospital. Yes. So just to reiterate that point, because I think it's really important to make it clear to your audience and listeners, We're not talking anybody bringing their Visa card out to pay for care. We're talking you get your care that you usually get for the surgery that you need under your provincial health plan, just not in the hospital. There are
Yes.
many people out there who are trying to twist that to say, you're going to pay for your care, it's going to be too expensive. That is not what anybody is proposing right now. All they're saying is you get your care outside the hospital, publicly funded. So I'm stressing that as a crystal clear point. Now, in answer to your question, what happens if there are not enough resources to do that? And so, for example, in the oncology world, for example, I don't recall when this was in BC recently, like in the past few years, they literally couldn't cover oncology radiation care. And so the province paid for patients to go to the USA to get it done, which sounds just unbelievable, but it's true. And so, this brings up the topic of, should a patient be allowed to pay for their own care outside the hospital if they can't get it done under public insurance? Now, this is way beyond my pay grade, but I would say that, in some respects, we treat our pets better than we treat our own human beings. Your pet has a problem, you go to the vet, they pay for their service, and it's done much faster than any human being can possibly get, let's say, an arthroplasty. So how is it that dogs and cats can actually access care faster than humans can? Because we have a significant constraint on our healthcare system at the universal payer system. So it's an ethical question. If the healthcare system as it stands now cannot provide patients the relief they need from their suffering within the bounds of reasonable human rights, well, why shouldn't somebody be able to pay for care elsewhere?
Absolutely.
I mean, how is that reasonable to say to them, no, you can't because you just can't? That doesn't seem right. So someone should suffer for that. The opioid crisis that we're experiencing because of people's chronic pain, let's say, for example, at least in part due to orthopedic delayed care, so we'd rather have them on chronic opioids than get their hip and knee replacement? That doesn't make any sense, does it? So we're prioritizing a philosophy of care over patients' actual needs. I just can't get behind that.
Yeah, absolutely. I like the comparison you made kind of with the vets and doctors. You walk in, you pay for it, it's done. But also how the media tends to twist what's happening and make it seem like you're coming with your credit card and things like that.
Mm.
And you're right, you're kind of putting people at a risk of other issues, like you said, the opioid crisis. We've heard stories of patients who their quality of life just deteriorates because they can't get that knee replacement, and they can't live their life as they want. So that's really interesting. A great point you brought up.
Thank you.
Um,
The other issue is that it's not just the delay of care that causes the opioids to become worse, but it's also the care escalation.
yes.
So again, speaking orthopedic wise, if you're delaying your surgery by 2 to 3 years, the joint becomes worse, the work involved is worse, the higher complication rate. Same thing in my world of otolaryngology. Let's say for sleep apnea work, there's more and more problems with sleep apnea accessing surgical care. Meanwhile, they can't get their care they need, so their hypertension gets worse, their cardiovascular status gets worse. So all I'm saying is that as our system stands now, we are unable to provide, in general, the needs of our growing population. And so doing more and more of the same is not going to solve the problem. Having a method to receive care outside the hospital is publicly insured, who wouldn't be for that? I mean, why not? And then you're right. If the public system cannot service a patient's needs in a timely manner that is really affecting their health and their human rights, why are we prioritizing a flawed system over people's needs? I just can't get behind that anymore.
Yeah, absolutely. For our listeners who might be interested, how can they find the petition that you mentioned in your LinkedIn post?
It's a great question, and there's an online link for it, and I'll send that to you after we're done here. Perhaps you can post that along with the rest of the posting.
Yes, yes, absolutely. And do you have any sort of final thoughts on the issue or any other comments you'd like to share or you'd like our
Oh,
listeners to hear?
yeah, no, I appreciate that. And I just would follow up with what you made a comment about the media sort of conflating the issues, but it's not just the media. There are activist political groups, there are certain political parties that are not in favor of these things. But I would just impress upon them the fact that, number one, when we're looking at changes of healthcare, change is always difficult. People are more comfortable with the status quo, even if it's flawed, because they're comfortable and they're used to it, until you're the one who actually has to access the healthcare. I mean, you face the 3 to 4 year delay in surgery. How would you feel about that? Is that okay? Is that going to make you feel all right? Or why not try something different? And so performing publicly insured care outside of the hospital is just getting the same care you've always had, but not in the hospital. And then as the second phase, if the public system cannot provide for people's human rights to alleviate suffering, isn't it time we think more broadly? I would leave it at that.
Yes, absolutely. So thank you so much for sharing your insights on this important topic. And that wraps up our discussion on critical issues within Canada's healthcare system. Please join us next time as we continue to explore critical topics shaping the future of healthcare. Until then, stay informed and stay healthy.